You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, according to my first guest, no more dentures. And we're talking about replacing missing teeth with mini dental implants or small diameter dental implants. With us, we have an expert on the topic, Dr. James Wardner. Dr. Wardner, welcome to the program.
Thank you very much, Randy. Nice to be here.
Now, before we get into today's topic, for people that don't know your practice, tell me a little bit about it. I mean, who's the typical patient? And what are the different services you offer?
We cover all bases in our office. We cover the young and the old and everything in between. We do children's sealants, we do fluoride, we do small fillings, large fillings, crowns, we do bridges, we do root canals, we do dentures, and we do partial dentures, and we do small implants and sometimes larger implants. We do the whole gamut of dentistry. So one of the biggest parts of our practice right now is helping denture patients recover from being debilitated, and we're doing so many cases of small diameter implants called mini implants, where we can help patients be able to chew again, be able to smile again, and be able to be assured and secure with their teeth and what they're able to chew with.
Now, you say that people can go in, you do this same day thing, where people can go in with a missing tooth, or they need their tooth extracted. In fact, you said on the phone, it's really cool, where they put a mini implant in, put a crown on top, and they go home that day. Is that right?
That's exactly right. We're able to do same day mini implant, put a crown on it. We can do same day mini implants and put a bridge, something stable, in the front part of the mouth or the back part of the mouth.
Are you busy doing that? Is that common nowadays?
It's becoming more common all the time, because now we have an assortment of things that we carry right in the office that we can put right in the bone, right in somebody to help them stabilize their teeth and chew immediately when they walk out the door.
Okay, and then the denture crowd.
The denture crowd gets even more of a benefit because they have many more problems, and we're able to stabilize their dentures. We're able to give them the ability to chew again, to smile again, to be secure, and they're coming and they're going to go to a restaurant again, to be able to join society again, and to be happy and pleased with how they're functioning, chewing, grinding, macerating their teeth, and also it helps with their nutrition.
How long have you been a dentist?
I've been a dentist for over 30 years.
Over 30 years. Because one of the points you made on the phone, you said it's like you're in vigor. Well, I'm paraphrasing, but it's like now because of mini implants, because of dental implants, that you're like excited about dentistry again. What did you mean by that? Why is it so important to you?
Technology's been a great thing for us. We've improved on so many different fronts. We have the ability to help people in ways we were never able to help them before. So in the old days, we would have to take two perfectly good virgin teeth and grind them down.
If you're missing one tooth?
If we're missing one tooth.
Okay.
In order to be able to give a patient back.
Like a bridge?
A bridge.
Okay.
2 teeth, 3 teeth or 4 teeth, something that they can chew on. We don't need to do that anymore. And now we can put a small implant in, we can put a crown right over the top of that. We've solved a big problem with a small project, and the patients love it.
So you love it. You say it's changed.
It makes my
your whole practice.
It makes my job easier because I feel like I'm providing more of a benefit to the patient. I feel like I'm giving them something that I couldn't give them in the past, that I couldn't even offer them in the past, because we didn't have the technology and the science to be able to do it, which now we do.
Okay, good. At the top of the show, I said that you believe no more dentures. Is that the future of dentistry, where, you know, with the adhesives in the mouth, that'll be gone?
Patients overdose on adhesives, and many of them can't function at all, even with adhesives.
Okay.
So now we are able to do same-day dentures, where we can put mini implants under the dentures, and we can preserve the bone support for the teeth.
So these are like snap-on dentures?
Snap-on dentures.
Okay. And it seems, it seems painful to put they're made of titanium, right? They just go in the...
They're made of titanium. They're very small. They're about that size. And there is no pain putting them in whatsoever. There's just, the gums are numbed, less numbing actually than a filling. And after the gums are numbed, with just like little pinches, we put the mini implants in, put the denture over those, and the patient walks out fully
They can walk out, that's it?
Fully functional.
How soon can you eat?
Right away.
Is that right? Now, we have to be careful. People need to know it's a real interview, right? and I'm not siding with you,
Right.
but you said there's no pain. So I know we always have to be careful with the no pain.
Right.
But are you saying it's like virtually painless, or patients don't complain about pain? Elaborate on that.
My patients don't complain about the pain from the mini implants whatsoever. Sometimes the adjustment in the acrylic under the denture needs to be done, which is true of any denture placed at any point in time. After a few adjustments are made, they're perfectly happy, but they're chewing the first day they walk out the door. Let's back up for 1 second.
Okay.
Traditional implantology, when we put a traditional implant in, we had to cut through the tissue, we had to open the tissue up, we had to stop the blood supply momentarily for the bone, we had to burrow a hole in the bone, and then we had to stitch that all back up with stitches, close the tissue, reinvigorate the blood supply, and maybe 9 months later to a year to even a year and a half, we were able to put teeth on the implants.
Okay.
That's no longer the case. Now we're making a minor poke, if you will, in the tissue, and we're able to have all of that gone away with.
The bone grabs onto these mini implants?
The fancy,
That's why they don't fall out, or
right.
what?
The fancy word is osseointegration. After a period of time, the bone actually sees that implant as if it's a tooth. So it's a wonderful thing in that it stabilizes the denture, but it also preserves the bone. With more bone, they're able to stabilize their denture whole much better. They
Okay.
also maintain their facial structure.
Yeah, that's true.
so
You
much
do
better.
see that sunken in look
Oh boy, do
on
you
denture.
ever.
So it's because their bone is slowly going away.
The bone is
Okay.
slowly going away.
Okay. So now mini implants, some people say they don't work. I mean, other dentists are very skeptical, I should say. But you say they're proven, they're methods. So there is science behind this.
There's lots of science, and there's more new science than ever before. Research is showing that they osseointegrate as well as a regular implant. And that if you put 2 or 3 small implants, you get even more integration and more stability. So there's no question about it anymore. You can argue it all you want.
So it works.
It works great.
Now, you said there's like a 5-year or 10-year study where they followed a bunch of patients?
Absolutely.
Like 90+ success rate?
Absolutely.
Success determined based on they don't fall out?
Exactly.
So they work?
They work. There's no question about it.
Okay, good. So let's talk a little bit about for the denture wearers for just a moment. Okay, is that a big problem? Like you're in Titusville, is that right?
Titusville, yes.
So there's a lot of people with dentures where you live.
Thousands.
Is that right? Like in Titusville alone, upper and lower denture, or upper or lower?
I'm sure there's thousands.
Thousands. Okay, and those people, according to you, can come in, get some mini implants, and get their dentures locked in.
Absolutely.
Okay, so if it's so good though, and there's that many people with dentures, why aren't they all doing it? Why aren't they coming in, making appointments?
They don't know. They
Okay.
don't know how even they're suffering. They don't know their inability to chew. Many of the patients don't wear the dentures any longer at all. They just set them someplace, and they might pick them up if somebody's going to be looking at them, but they can't use them. So that's one reason. And then they don't come to a dentist because they don't know what we can do for them any longer. They're out of touch with dentistry, modern dentistry, and what our abilities are to help them get over the suffering that they've been going through. Many of the denture wearers don't have any idea, unless there's an outside resource for them to get to or comes to them, that there's something new that we can offer them so that they can live life again and enjoy eating again.
And pain, you're saying, is not like a big part of this whole thing.
Many of these denture wearers suffered through years when they had their teeth. They had to have root canals, they had to have periodontal surgery, they had teeth extracted, they had uncomfortable abilities to chew. They're kind of like over it and done with it, and they really don't want to go through that whole process again. So having already been there, done that, they can't quite imagine that something can be so easy for them to get them into a new position where they can chew and smile and eat the food that they want to eat. Finally.
So you fit people for dentures in your practice, and
Absolutely, we do.
I guess you've been there 10 years in Titusville.
Right.
Are you of the position that every one of them could benefit or should find out more about mini implants?
Every patient that's had a denture should come in and evaluate how we can do mini implants for their denture. They don't realize what we can do for them to help them chew and eat better. There's a great story or a great example about how this could work for the patients, because if they could come in and they could try the mini implants under the dentures, they would never turn back.
They wouldn't go back.
They would never go back. It's like when black and white TV went to color TV, and the retailers were trying to figure out how to sell the color TVs. So they let the buyers take them for 30 days and said, if you don't like this, just bring it back and return it. Well, no one brought them back. And so the same the same thing is going to be true of the denture wearers. Once they get the mini implants, they're not going to not like
So
them.
the patients you've done this for, what do they say? That means a denture wearer comes in and you give them mini implants to snap in.
We have a patient, his name is Glenn. He came in with no teeth, but he's an entertainer. And he wanted to sing again. And we gave him 6 mini implants on the upper, 4 on the lower, a new upper and lower denture. The teeth look like they're his teeth. Not only is he singing again, not only is he entertaining again and playing the guitar again, but he's teaching music again. And he told me not long ago that he's got something he never had before, even with his natural teeth.
What's that?
Now he's able to whistle.
Okay. He wanted to whistle.
He didn't know he wanted to whistle, but now he can whistle.
Okay.
So that's just one example of a patient that's done very well.
But is it common? I mean, you hear these.
I have another patient. We did 4 mini implants on the lower, under a lower denture, and I don't see her anymore.
Okay.
And I don't see her anymore because I can't get her to come in, because now she feels like she has a set of teeth and she doesn't need to come in anymore. So we see her son. Her son comes in every 6 months for a cleaning, and I ask about the mother. How's your mom doing? Great. How's she chewing? Great. Any problems? No. Are we ever going to see her again? Don't really know. Maybe not.
Okay.
So we'll see you in 6 months, right? Yeah, right. So we have cases like that where the difficulty is that the patients don't come back because now they have a set of teeth that they can finally use.
They
and
can
function
eat,
with.
they can chew.
They can eat, they can chew, they can smile. They don't need us
Now,
anymore.
I know a few denture wearers, and they seem to be fine. They never complain about their denture. Are denture wearers really miserable about this?
Denture wearers hate their dentures, most of them. And if they're honest with you, they'll tell you that they hate their dentures. They can't eat, they struggle, they're insecure sometimes, they open their mouth, the dentures fall out. If they don't have much support for the denture, there's not a lot that you can do for them. I tried to make my own father a set of dentures when he had no bone after years and years and years of wearing a denture. The dentures rub on the bone and they just basically rub the bone away. And I struggled many years ago making him a good new lower denture.
How come you just didn't do mini implants?
We didn't have that as a resource
Okay,
back then. We
okay.
didn't have the technology, but I can assure you I would have used that if he was here today.
Okay. Now, in your office, you have a CT scan, and correct me if I'm wrong. How it's normally done is you go to one office and they put the implant in. Then you go to another office and then they put the tooth on top or the teeth on top or the denture on top. And then they go to maybe somewhere else for the imaging. You do it all right there.
We do it
What's
all
the
right there.
I mean, other than convenience, what's the advantage?
Well, the convenience is there because the patients don't have to run around, make various appointments, one day, different hours, travel here and far. And a lot of the older patients, they don't want to do that. They don't want to travel hither and yon.
Okay.
So here in our office, we have the ability to control every aspect of the flow of what's going on. So we get the CT scan, which is basically a 3-dimensional view of what we have to work with. We're able to put the mini implants in. We have them in stock and they're right there in the building. And then we have total control over the lab and the quality of the lab, which is very important to me. I like to make sure that I know what the patients are getting, that if it's crowns, they're not made in another country, or if it's a lab, I have control over the lab, and I want the teeth to look normal. I want
So
the
they
patient
look
to
like they end up with a great looking smile? Because I feel like I
Absolutely.
could spot dentures.
No, it's very important in our office that the patient, that when you look at our patients, no one would know that those are fake
Really?
teeth. Absolutely.
Do you find that people smile more? Because you say there's like changes in the personality.
People who haven't had the ability to smile for a long time find it difficult to smile even when they have a natural set of teeth in their mouth. But
Okay.
after they have a natural set of teeth in their mouth, their whole musculature of their face changes and they begin to glow when they start smiling.
They glow.
They glow because
Okay.
smiling becomes more natural
Good.
again. They don't have to hide their face, they hide their teeth. it becomes a thing of joy. You know, it's like sharing with one another, sharing your smile, sharing who you are.
Good, good. Now you brought some models.
I did.
Teeth. What are we looking at? So do you show this to patients?
I show this to patients
Okay.
all the time.
Now people are just tuning in. We're talking about replacing missing teeth with mini, small diameter dental implants, and also, according to Dr. Wardner, no more dentures. Everything should be fixed. That means you can get a fixed set of teeth in your practice.
Absolutely.
Secured by mini dental implants.
Exactly.
So you show them this. So what is this?
So this is, in this case, is a lower jaw with 4 small mini implants placed. You can see how small they are. They're not large at all. So underneath the denture, there are 4 small housings that seat on top of the mini implants and snap directly onto the mini implants and give plenty of
So let me take a
resistance
look at
and
this.
friction.
Is this accurate as far as the pulling power? Okay. So you just put the implants in, like right here in the lower, snaps on.
Snap right in.
What could they eat?
They can eat anything, anything at all. They can eat steak, they can bite into an apple, they can eat corn on the cob, virtually anything.
I mean, doesn't it depend though on how many mini implants you put in their mouth? Like what's the typical, like what are the options for
Okay.
these patients?
Well, normally 4 on the lower. On the top, this is an example for the patients to see of what 6 small mini implants would look like in the upper jaw. And on the underside of the upper denture are the small housings that
Just
fit
snap it on.
directly onto the mini
So
implants.
aside from the denture wearers, what's another candidate, patient that you see that come in for dental implants?
We have patients who have struggled with nasty looking teeth, holes between the teeth because the teeth have drifted, alterations in color where the teeth are not all the same color, and they just look terrible.
Okay.
Teeth can be loose, gums unhealthy, horrible breath. As a matter of fact, a periodontal, meaning a gum-related patient, you can smell the breath from a good distance away. So in cases like this, the solution oftentimes is a denture.
Okay.
Where we can take all those teeth out and put a new denture in.
But aren't their gums too bad?
The interesting thing about the gums is it's the bacteria from the teeth and the deposition, the deposits around the roots of the teeth that really make the gums nasty. Once the teeth come out and the immune system kicks in, the gum heals up beautifully, the bone sockets all fill in, and we have a beautiful ridge to put a set of dentures in.
Okay. So this group, they come in. You say that they say, Doc, this is the worst you've ever seen.
Yes, they say that sometimes.
So is that common, they say that?
That's common. People will come in and they'll say, I know you've never seen anything like this before.
What do you say to them?
I say, we can help you.
Okay.
We can help you. And the thing is, I like doing that because that's real cosmetic dentistry. When you can take a person that's that debilitated, teeth even splayed and loose, and give them a beautiful smile, the ability to chew, and a lock-in denture, you're really helping that person. They're going to have a totally new ability to function and chew their food and have a life of pleasure rather than a life of constantly hiding how they smile, hiding how they look, having to chew over here because I can't chew over there because I have a loose tooth over here, having to maneuver food around in my mouth because I don't have any teeth down here, but I do have teeth up here. And people struggle like that. There's a lot of people out there who really, they have, the person like you and the person like me who has, fortunately, a full set of teeth, and we just go to our meal and chew it the way we want. Those poor folks out there have no idea how they can be like that too if we can just help them with these small mini implant dentures.
Now you talk in terms of like transforming people's lives.
If you think that you can help a person smile again, if you can help a person chew their food well again, that's a big deal to a lot of people who can't do that today. They may even have given up a part of their life in that they won't go to a restaurant or they won't go to a steak restaurant because they know they can't chew that food. But if you have the ability to help somebody get their oral health back,
Okay.
their teeth, their smile, their ability to chew, to digest their food, because you have to chew your food up into small pieces in order to get it digested properly. So that's a big deal, and I think that really does help people change their lives.
And you're big on this same day, okay? You told me that you do things in the same day for the right kind of patient. I mean, there are people that walk in without teeth, and they could walk in with kind of a snap-on denture.
Exactly.
And they could go home that day and chew and eat.
Exactly. Some people have a denture that's not too far off. It's pretty well fitting. If they come in with a denture that's pretty well fitting, we can put small mini implants in. Same day, they can walk out with that denture and go home and function with a set of teeth that's stable. Other people, they don't have the luxury of having a good denture. They may have had a denture for years, the bone has changed, the tissue has changed, things just don't fit anymore. So we can't help them with a mini implant if the denture just fits horribly. So those people need a new denture too.
Okay.
But if you give them a new denture with mini implants, they're back to loving life again.
Why do you like mini implants? You use the term mini implant. Why do you like it better than regular implants? Because they both work.
Yeah, Randy, I can tell you they are so non-invasive and they're so easy to place, both for the technician, for the doctor, and for the patient. And there's no time. You don't have to have them come back 6 months later, uncover the tissue, make another reincision, somewhere along the line take sutures out. Most of the time you just put the small implant, you screw them in, and they're there, and it's over, it's done.
Even dentists don't believe it could be this easy, or that they work, right? Is that true? Because I've had people tell me, knowing you're coming on my show.
Yeah.
So what do you say to dentists that are going to watch this show about mini implants?
Well, here's what's going to happen. More and more dentists are going to be doing this procedure.
Okay.
Because we didn't have the research in the past to demonstrate that it was as effective as the old kind of traditional implants. But now the research is there. More and more people are doing it. More of the patients are talking about it because they're seeing that, hey, I've been helped by this process. So altogether, between the technology, the understanding and the education for the doctors, and the patients appreciating what's being done for them, there's going to be a mushroom effect of this procedure being done in the United States, for sure.
This is your prediction.
My prediction.
You said it here, right here.
I said it right here.
Okay. And it's about, I think you told me, 70% less than traditional regular implants. Is that right?
The first thing that people have in mind when they come in, whether it's a spoken question or an unspoken question, is how much do things cost?
Okay.
I had a patient come in the other day, made a phone call regarding traditional implants. She told me the cost was going to be $64,000.
Okay.
To put many implants in, to put snap-in dentures, there's nowhere near that cost. And
more than half off?
More than half of. And not only that, but we have ways in our office to help patients finance these things so that they can carry the financing out for literally years if they need to. So not only can we get it done painlessly, but we can get it done economically. Okay. And that's a big benefit.
But regular implants do work. I want to make that clear.
Regular implants
good.
Absolutely.
You're not saying anything negative about them. You're just saying this is a less expensive option that works?
Absolutely. Regular implants do work. Absolutely, they do work. One of the things that's important to know also is that it's not just the implants that are supporting a denture. It's the tissue as well. And if all of the process is done properly, you have the implants and the tissue and the bone all supporting this denture.
Okay.
There's no rocking, there's no rolling, it's solid, it's in there. They can put their teeth together and they can mash till the cows come home.
Same day?
Same day and solid.
Okay. And they could eat, they could eat, what about like pasta al dente or like salads?
They can eat.
My father was a dentist. I mean, certain things are tough. You have to avoid.
Yeah,
they can eat all this stuff?
I think they can eat anything from nuts to steak to
nuts
apples
too?
to corn on the cob, anything that they want to eat after those mini implants are placed in the
Do you have patients that have told you they can do those things?
Oh yes, I've had patients that tell me that they can eat anything. As a matter of fact, I go out to dinner on occasion with one of my friends who we did this for.
The mini implants.
The mini implant dentures, and there's no stopping him. He can eat anything he wants to eat. And
well, like what? I mean, really, they can eat? Because, going into this again, even my other dentists are saying, because with regular implants, you could literally eat corn on the cob. Right. I did not know you could eat like corn on the cob with mini implants?
Yeah, it's
You
not
can.
a problem. Yeah. We go to a Chinese restaurant where you can pick and choose, you know, a buffet style, you know, anything that you want out of there. And I haven't seen him stop at anything. It doesn't matter what they have displayed there to eat. He'll pick it up and
What
he'll
does
eat
he
it.
say to you? Give me some inside scoop. So when it's all done, do they say, I should have done this years ago?
Well, he's so pleased that he wants me to use him in an ad for the mini implants. Because,
Really?
yeah, he's an entertainer. And now he's just so happy because, I mean, he's trying to date. I mean, he's trying to find the right girl.
And he wants to put that in an ad that he
Yeah.
has teeth that are...
That's right.
Okay. On the consult, do you ever, when you hear their hard luck story, you know how bad it is, do you ever get excited? Because you know what's going to happen?
Yeah, I get excited when I see their excitement. So once they know that they're a candidate and that they have hope, I'm happy to know that they're excited about that. But I know that's not going to be the end of it, because as we go through the process and they begin to see that they're going to have teeth again, and then at the end, when they have their teeth and they come back in and they say, I'm able to chew, smile, and do things I was never able to do for years and years and years, I get a great pleasure out of that. I enjoy helping people.
How old can you be, and we're almost out of time, how old can you be to do this?
Well, we've helped patients that are in their 60s, 70s, 80s, 90s. There's no
What's
age
the
limit.
oldest you've ever heard that's done this?
Oh, I'm sure I have colleagues that have gone into 100.
Why would a 90-year-old want to do this?
People need to eat. If you want to stay
Okay.
alive, you've got to eat. So people really want to chew and they want to eat. And you can't eat well at all with a loose-fitting denture. You can't chew your food, you can't get good nutrition, and you won't stay alive unless you have a well-fitting denture.
But isn't it true, though, that if somebody's been in dentures for 30 years or 25 years, that they can't do this? They don't have enough bone. What do you do with those people?
Well, first of all, it's not true at all. We can do amazing things with people who have had dentures for 10 years, 15 years, 20 years, or 50 years.
Okay.
We need a little bit of bone to be able to put the mini implants in. Most
Okay.
everybody has a little bit of bone, and we can help just about anybody who's been a denture wearer for any length
All
of
right.
time.
Well, I want to thank you for coming on the show. Final message to somebody that's watching this, a denture wearer, they're missing teeth. What do you say to them?
I'd say, come on in, free consult. Let us take a look at you. Let us see if we can help you. I think we can, and I'd be more than happy to do it.
All right, great. Thank you for coming on the show. Very, very nice. Very interesting. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.